I just wanted to start with welcoming everyone and thank you for joining us. So this Q&A session is going to run every month on the first Monday of the month so that it's easier for us to be able to remember it. And if you want to put in your calendar, October 2nd is the next one. Daisy's going to be mentioning that at the end before we close off. So today we're going to start with some questions that were submitted on the topic of anxiety. And we're going to go through these questions. There's about 8 in total. And then if you still have a question that you would like answered, then by all means, you can put up your hand and Daisy will bring you on and we can ask that question directly, or you can stay off the screen, whatever your comfort level is. Okay, so this course, this Q&A is going to be recorded. It'll be live streamed on, it was to be live streamed, but there's where we had some complications. So next time around, we'll have it on live stream as well. So just a few other things to note. If you're familiar with your chat, if you're familiar with your Zoom, there's a hand to put up if you have a question, and then we can bring you on. But for now, if you could just unmute yourself, that would be great. Or mute yourself, and then we'll unmute if you come on with a question. So another thing to make note of is that it's in Central Standard Time. So depends where you are in the world, your times may change. So just check your local time zones. And the Zoom meeting link that we have here is going to be the same link that we have every single month. Okay, so that will be easier to remember as well. And Daisy's going to send out reminders each month to make sure that people know exactly when we're on. Okay, so let's start with a few of the questions that came out. So one of the more common questions that was asked is, what is anxiety? And the answer, we'll break it down. I'll read it and then I'll kind of break down what it means. So anxiety is a natural human response to stress or perceived threats. It's a feeling of unease, such as fear, apprehension, or worry, and it can vary in intensity from mild to severe. It can be a normal and adaptive emotion that helps us prepare for challenges, but it can also become a problem when it is excessive, chronic, or interferes with daily life. So again, when we talk about perceived threats, this is a stimulus that is arousing the emotion of fear. So often it's the way we are identifying with a certain situation or environment or people that we're working with. We see it as perceived threats. Now, I'll use one example with my anxiety and OCD. One of the perceived threats was if I was to touch a doorknob, my perceived threat and my anxiety level would go high because the threat that I associated with that doorknob was that I was going to get sick, or worse yet, make other people sick by touching that contaminated door. So as a result, it makes you feel unease, and you often will be apprehensive about doing things, or you will worry about it. Did I do it? Did I not? Should I have done it? And you just sort of have that rumination going on and on. Now, anxiety can be a normal and adaptive emotion, right? So it prepares us for dangerous situations. But what we tend to do is we feel this anxiety even when there is no threat. And I often refer to that as false messages the brain signaling to the rest of the body. And we'll talk more about that as we go. Now, also, anxiety can shift on a continuum. So it can go from mild to severe and anywhere in between. So if you look at it, I'm visual and I'm a visual learner. So I look at it like even a popsicle stick. If you took a popsicle stick and you read it on the left side of the popsicle stick, mild, and on the right side, severe. The anxiety can move on that stick from mild to moderate to severe and fluctuate back and forth depending what's going on in our life and where we are with our anxiety. But where it becomes really interfering with our life is when it's chronic. So meaning ongoing, excessive, and as a result, it starts to close our world smaller and smaller. Okay. Now, with all these questions, if you need something elaborated on, by all means, make a note of it and we'll come back to that particular slide. Now, what causes anxiety? Now, there's many reasons we have anxiety, and there's various causes. So we look at genetics. Genetics will often play a role in it because we have what we call a predisposition to it. So often when you're thinking about your anxiety, you can reflect back and recognize that anxiety was also coming and stemming from maybe your mom, your dad, maybe a grandma, an auntie, uncle. And often those genes are passed on to the next generation. It doesn't mean that the person will automatically develop anxiety because there's other factors that play a role in it. So brain chemistry, when we talk about that, we're looking at the neurons, the neurotransmitter, the messaging parts of our brain are misfiring. So it's kind of like a hiccup in the brain. We often will have a misfiring of it and it's not running smoothly. So our thoughts aren't moving smoothly either. Personality, sometimes people are more sensitive than others, so they may just be more prone to anxiety, and life experiences. So depending on where you are and what stage you are in life could also cause more anxiety. So when we look at triggers, we want to look at stress. Stress is a huge trigger for anxiety. If we're going through a lot of stress, our anxiety will usually spike. It's very common for that to happen. We look at trauma. Trauma is another big key component. And when I look at trauma and I think about one thing that stands out for me that I often say with my clients is everybody that lives with some form of mental illness have experienced one form of trauma in their life, up to like 89%, but you know what, it's probably closer to 100. So we need to recognize that people have had trauma in their life, and it may be trauma directly related to them, or they may have witnessed some form of trauma. But either way, that can produce a lot of anxiety as well. Major life changes. So when we look at major life changes, maybe transitioning into school, into the school system, children are getting diagnosed with anxiety younger and younger. There's a lot of expectations on social media. So there's pressure, not only for children, but adolescents, teens, geriatrics, middle age. At any point in our life, we could experience anxiety. Another one is medical conditions. So if we are diagnosed with a medical condition, that may increase our anxiety level. And substance abuse. Substance abuse can also be a trigger. Next, we talk about, is my anxiety normal? And I often say normal is, a client told me once, normal is a setting on a washing machine. Everyone's normal is different. So, but when we're talking in context of anxiety, definitely it's normal to experience anxiety from time to time, especially in response to stressful situations. So again, we look at the context it's in, the frequency, you know, is it ongoing? Is it intense? Does it impact your daily living? There's people that can manage their anxiety and it's only in isolated situations. And then there's other people, that can't, it starts to spiral into all aspects of their life. So seeking help from someone, from a health professional point of view, is really, really important. And I think that with seeking out medical help, making sure that it usually starts with your doctor, and then the doctor can refer you to someone that specializes with anxiety. But you do have to definitely seek out professional help and the appropriate professional help. So the next question How do you differentiate between what we would consider normal worry and where it's gotten to the point where it's clinical anxiety? Well, we look at three areas. Again, the duration, intensity, and impact on daily life. So let's break that down a bit. The duration. So how long has this been going on? Is it something new? Or sometimes people have been living with anxiety for decades and they have never reached out for help. They just feel it's a part of who they are. It's their identity. When in actual fact, regardless of how long you've been living with it, it's important to seek intervention. And that intensity is, how intense is it? Like we talked about before on that continuum. And then the impact it's having on your life. Now, clinical anxiety typically involves persistent and excessive worry or fear. And it's interesting, through the diagnostic manual, they say you have to have lived with anxiety for 6 months in order to be diagnosed with anxiety disorder. And I find that a long, long time. I would hope that anybody living with anxiety out there that would seek intervention earlier than that, because it usually does disrupt your daily functioning. And I find with a lot of my clients, the longer they've been living with it, the more impact it's had in a variety of areas of their life. So again, if you're not sure, the first step is seeking professional help so that they can distinguish with you what is and what isn't anxiety. The next question is, what are common symptoms? Now, when we look at a symptom of anxiety, we look at, usually a symptom is more what the person is conveying to you, to the health professionals, or even to family. If family asks, what are some of the forms of anxiety that you're experiencing? What are some of the symptoms? Pardon me. A lot of times, these are some of the more common ones. It's not an exhaustive list, but these are some of the more common things that people will come forward with. So I'll let you read those, and then I'll maybe talk about one or two. Okay, let's talk about rapid heartbeat. A lot of times people will present in the ER emergency room with symptoms such as rapid heartbeat, sweating, trembling. They'll have shortness of breath. And a lot of times these symptoms mimic a heart attack. So it's natural to be very scared and feel that a lot of times people will say, I feel like I'm dying. I feel like I'm having a heart attack, because those symptoms are real to that person. And a lot of times they don't know why they're feeling that way. So they go to the ER and they get checked out and they run all these tests. And then the doctor tells them there's nothing wrong. So often, more times than not, the person will think, well, even the doctor can't figure it out. It must be something even more serious than I thought. So then they leave the ER and then they start just obsessing about all these symptoms and when it's going to happen again. And will they be alone? Will they need intervention? What if no one's there to help them? A lot of times there's embarrassment around their symptoms. They don't want other people to see them going through that. And really, the point of knowing your symptoms is to be able to recognize them in advance sometimes, and then also in the moment. So saying to yourself, talking yourself through it and saying, you know what, I'm feeling my heartbeat right now. I know I'm sweating. This may be a panic attack. This may be anxiety, but I'm going to work through it. So a lot of times with this, they feel there's a lot of trembling or shaking in the limbs, the upper extremities, the lower. Some people will say their legs are really weak or wobbly. They can't feel their legs. Now, when we get that fight or flight, that anxiety initially, now the body is responding, the brain is responding to this perceived threat more times than not, that something bad is going to happen. And so the brain sends a signal to the rest of our body to respond. So in a moment like that, the body is kicking into high gear, and it's setting blood flow to the bigger organs, like our heart, our spleen, our stomach. And often we don't have a lot of blood flow to our fingers or our legs or our toes. They can feel numb at times. Now, that is the sympathetic system kicking in. So it is our human instinct to respond to these perceived dangers. But what people fail to recognize is it's a false message. The brain is sending off false messages, just like our fire detector when we cook, or if there is smoke in the air, it will send that trigger, that set off that fire detector. But in this case with anxiety, it's a false reading. There is no fire. There is no need to respond. But we do, because it's a natural instinct. So that's sort of what happens throughout the process. And I don't want to minimize it, because when these symptoms occur, they can be very terrifying to the person. And from the outside looking in, we might think, well, they're acting odd or bizarre. Like, why are they doing that? But just always remember that everything that they're feeling is real to them and can be causing elevated anxiety throughout the process. So, questions. Are there effective treatments for anxiety? Definitely. This is the good part. This is the good news. There's many things a person can do. Now, psychotherapy, that is a form, that's actually the CBT, what we call CBT, cognitive behavior therapy, is the gold standard treatment for anxiety disorders. It was produced in the 70s, and to this day, it's still the #1 treatment of choice to overcome anxiety. Now, within that treatment, if you look at CBT as a form of treatment or therapy, the #1 technique within CBT is called exposure response prevention, ERP, where we start to expose ourselves to the fear, the things that causes fear, and we start facing and challenging the fear. Because I always remember a lady by the name of Lucinda Bassett, who lived and struggled with anxiety. She said years ago when I was taking her course, that was back in the early 90s, she said, there's no way around fear but through fear. You have to hit it face on. There's no other way. And the more we avoid it, the worse it gets. And I'm sure some of you listening will be able to identify with that. Now, another choice may be for people to start taking medications. I know some people are totally against it, and other people are willing to take it. Now, here's what I like about the medication. These are, as we talked about earlier, part of creating anxiety or developing anxiety may be biochemical. There may be a biochemical association with it. So this is where medication can be really, really helpful in being able to just take the edge off initially and then help with that more. So there's also lifestyle changes. Now, when we look at lifestyle changes, there is the lifestyle changes could also be another part of it, the lifestyle change in the way of being able to change certain aspects of our life. So it might mean getting rid of things that are negative. It might mean cutting back some and having more me time. And that could be another piece of it. The other thing is self-help strategies. Self-help strategies could be another form of working on maybe self-help books. It could be exercise. It could be any of those things. Now, the choice of treatment depends on the severity of the anxiety and the individual preferences. Again, ultimately, it's up to you on what you want to choose to use or what to work with. And sometimes you have to try a few different things, right? You have to try a combination of medication and CBT, maybe change your lifestyle in certain aspects of it and see what works for you. It's not a cookie cutter system. You're going to have to try many different things. Now, how can I manage and cope with my anxiety on a daily basis? This is the big one. Coping with anxiety involves various strategies. So some of the things that you want to try with the coping strategies is practice relaxation techniques. So things like deep breathing, meditation, regular exercise, maintain a healthy diet and get enough sleep, limit caffeine and alcohol intake. Now, not everyone realizes that caffeine is a stimulant. So it can, if you're already sensitive to anxiety, you may become more sensitive to the caffeine intake. So you might want to eliminate caffeine out of your vocabulary altogether. Also, alcohol intake can make anxiety worse. It might work in the moment, but in the long run, it's not going to be very effective. Okay. So establishing a daily routine is really important. So getting your hours of sleep, having me time, getting through all the daily events is really important. And just being able to challenge yourself on a regular basis to get out of our comfort zone is really essential. Now, we want to talk to a trusted friend or therapist. This can be really hard to do because your family and your friends may not understand, or they may not be supportive. So you may have to go outside your circle of friends to be able to find somebody that can help you with it. Now, challenging negative thoughts. This is a big one. I find that if we're able to challenge our thoughts, then we're able to look at things a little bit different, because a lot of times the anxiety is established over many years and it can be really, really hard to change our way of thinking. It just happens automatically. So the negative thoughts might come automatically without even having to process or think about it. So we want to make sure that we are aware of our thoughts and be able to challenge them. Because a lot of times it's the way we talk to ourselves and the negativity that we put on ourselves that makes it worse. We want to set realistic goals and prioritize tasks and consider stress reduction techniques like yoga or mindfulness. Now, in this part, I always say that the relaxation techniques have to be practiced in the comfort of your own home so that they can be implemented out in the communities. Because the last thing you want to do is be learning techniques when you're in the middle of anxiety or a panic attack. Then we're going to focus on the different types of anxiety disorders as well. In future sessions, we're just going to get some feedback of what people want to questions and answers to, but that's going to be one of them for sure, probably in the next session that we have. We're going to go over the different types because there's many different types. Now, the next question is, can anxiety be cured? I get this question a lot. Can anxiety be cured? I also work and live with OCD. Can OCD be cured? Can depression be cured? None of the disorders can be cured, but we can sure learn to manage to live with them. And we can live alongside them where they don't have the impact or control over our life. So, with the right treatment and coping strategies, we can manage them, but they may not always be cured in the sense of completely eliminating all anxiety. Some individuals may experience periods of remission, while others may continue to manage their symptoms over the long term. So again, it's very individualized and depends what's happening in our life, because life happens all around us. So it will come and go. It'll peak and it will drop. And we call it wax and wane. So we'll have good times and bad times. Now, the goal of treatment is typically to reduce symptoms, improve functioning, and enhance your overall quality of life. It's important to work with a healthcare, as I mentioned before, and get a personalized treatment plan. And that is probably one of the biggest things I do over the course when I'm meeting with someone for the first time. We spend 1 to 2 sessions on getting a really good snapshot of what's going on in their life and be able to see how we can build a solid foundation to be able to work on overcoming their anxiety. So we look at every aspect of their life, how the anxiety is affecting them on a personal level, how anxiety is affecting them maybe at work, in a family or social setting, and so on. And then we rate an anxiety level with each of those items from 0 to 10. So 0 being no anxiety, maybe a 1, all the way up to 10, where the anxiety is extreme. So we're able to capture through the snapshot where our starting point is. So I'll have my clients work through the lower anxiety items, and once they get comfortable with that, we build on that. It's like building blocks, so we're able to get to those higher items over time, but we have to first instill the belief in ourselves, right, that we can do it. So I think that covers those questions. This is where you can reach us at theocdcoach.com on our website. Our email is info@theocdcoach.com, and of course by phone. And we are also, Daisy is doing a great job on getting us out on the different social platforms: Facebook, Instagram, LinkedIn, TikTok, and YouTube. So now, if there is any further questions, maybe we'll just take those now. Daisy, are you there?
Yes.
Okay. I can't, do you see anything in the chat? Any questions coming up?
No question.
Okay, thank you. Does anybody, from a show of hands, anybody have questions? Okay. All right. So our next date is every first Monday of the month, as I mentioned. The next session is October 2nd at 7 to 8 p.m. Our Q&A Zoom meeting will take place there. And then you can join the meeting. Daisy's put a regular link for the meeting. And then we also have a link where you can send your questions to. If you're not able to make it, or you just want to set the questions out in advance, feel free to do that. So again, thank you for your time, and I'm hoping to see you at our next session. If you want more detailed or detailed information, feel free to reach out to myself at the website, and we're only an email away at info@theocdcoach.com. And we also have different programs available. And maybe just the first step would be just to start by reaching out and doing a free 15-minute discovery call, just to see, what your symptoms are and how maybe I can be of service to you. Okay, so thanks again. Take good care of yourself, and we'll see you on October 2nd. Bye-bye.